Bloat is a fairly common thing that happens in veterinary practice. Bloat by itself is an emergency, but it's what can happen next that is the true emergency. So we call it something called G.D.V, which stands for gastric dilatation and volvulus. So gastric dilatation is bloat. It's where your stomach, which is basically like a balloon, fills up with air and causes your animal's abdomen to be distended and uncomfortable. This can happen in any dog, but it's more likely to happen in the deep barrel-chested dogs. So German Shepherds, for example, Great Danes, Weimaraners, anything that has that body shape where there is space for the stomach to then bloat up, that's where it could happen. We normally find it happening if an animal has exercised too close to eating, and this can happen either way. So if it's eaten before it exercises or after it exercises, it can still happen. And the reason that happens is because if you've been exercising, you'll still be breathing a little bit faster, panting a little bit, so you'll be taking more air in when you're eating. So that air combined with the food, and your stomach is trying to do its thing and break down the food, will result in more production of gas in the stomach. What can then happen is if your stomach is dilated, bloated, it can then twist like a balloon would float. The stomach can do the same thing. When that happens, that's when it becomes a true emergency. So what will happen is with the twisting, all the blood vessels supplying the stomach will also twist, and then you start to reduce the amount of blood that's supplying that stomach lining and the stomach in general. You then could lead to death of the stomach, so what we would call necrosis of the tissue, and that's when you either have surgery or your dog unfortunately won't make it. So bloat is an emergency, and it's always best to get your dog checked out by your vet, because it could lead on to this twisting of the stomach, which can be fatal. In order to reduce the risk of the G.D.V, the bloat happening in your dog, you want to make sure that you're not exercising them within half an hour of feeding them. You also want to ideally split your dog's meals into 2 meals a day rather than just the one, because then they're having less food in each meal. You also, if they are quick eaters, you would ideally use bowls that would slow down their eating, because the faster they eat, the faster they're getting that air in as well. There is some controversy over the height of feeding bowls. Some people believe that feeding at a height will increase the chance of getting air into the stomach and for the bloat to happen. My thoughts are that if you're feeding at neck height, so dog isn't having to reach up to get a food bowl, then there isn't any greater risk of that happening. But if you're unsure, discuss that with your vet and see what the advice is regarding where to feed them. The other thing you want to do is see if there's any history within that litter of the dogs that you have, any history of G.D.V happening, because there is a little bit of not a genetic component, but it does tend to happen in the same line. So it is worth knowing if there is any familial history of it happening. In a dog with bloat, the first signs that you may see are unproductive vomiting. So your dog may be trying to vomit and may not bring anything up at all. If they do bring anything up, it tends to be like a white foam. But if your stomach's already twisted, then the chances are that nothing will come up at all, but they still will try to bring something up. They also become quite restless, pacing, because it's very uncomfortable. The most noticeable thing is that their abdomen will bloat up. If you're not sure or you're concerned about this, get a tape measure and measure around the dog's abdomen and monitor it that way. And if it's increasing in size, then you need to get seen quite quickly. It will lead on to respiratory breathing difficulties, and especially if the stomach is twisted, you're going to start to get symptoms of shock that have been discussed previously. If that is the case, there's just no time to waste. You need to get to your vet really quickly.